So I'm a family physician up in Gardner. My practice is called In His Image Family Medicine. And it's a full-service family medicine, including delivering babies, taking care of the babies in the nursery, and taking care of those babies 90 years later in the nursing home. My background, it's just important to know the American Academy of Fertility Care Professionals. It's a service organization and a certification organization that certifies doctors like me and Dr. Rollo in the back of the room that we are very well trained in treating infertility without resorting to frozen embryos and the like. And we're supported by, in green, the International Institute for Restorative Reproductive Medicine. Okay, these IVF centers, when they're creating these embryos, they're putting them back into an unhealthy situation usually. They haven't fixed the situation. They haven't even diagnosed the situation. They don't even necessarily have a clue about the situation. The restorative reproductive medicine doctors around the world are just totally fascinated by how many unexplained infertility diagnoses there are at these specially, they call themselves specialized infertility centers. 60% or more are unexplained. In my practice for 25 years, I have not one case of unexplained infertility. And I'm just the podunk doctor up in the woods in Gardner. Family physician, not a reproductive endocrinologist, and yet I can explain every single cause of infertility. And you'll see the data on how well we are able to fix those very shortly. Finally, just to let you know some more good news, the National Gianna Center for Women's Health and Fertility has sprung up in New Jersey to help doctors like me set up their practices after they finish their training. Because as you know, the medical system is very complex. And it's very hard to set up a practice. And if you have a CEO that doesn't believe in pro-life activities, or you don't know how to contract with the insurance companies, then oftentimes these doctors find themselves just mired in the business of medicine, and they sort of give up these restorative reproductive medicine approaches. So keeping with our spring theme, here's a picture of my family several years ago. They're now all over 6 feet tall, 4 boys, and the one who's standing on the rock to make himself look as tall as his brothers is now the tallest in the family. What you see behind us is Angel's Landing, Zion National Park in Utah. And I thought you might like to be woken up in the morning and see what it looks like from the top of Angel's Landing.
Wow. Oh my God.
This is 1,500 feet straight down. And that's Peter, who's now a healthcare attorney in Massachusetts and Connecticut. To make it more dramatic, he has his basketball shirt on. Looks like somebody's ready to push him off the cliff. Maybe that's how you guys feel some days. So I thought I'd start with some more fun topics. Secrets of success. And we have a very prime example here in our state of a very successful organization. But first, I wonder how many of us can appreciate this concept. But you notice who's smiling? The person with the truth, the person with the secrets. And we know that the truth will win out, even though it looks pretty gloomy some days. So it's a little bit of a confusing picture out there. You have people aligning with different sides of the issues, and people being challenged in their own beliefs. But these are very critical issues. Critical in the schools, as Linda has helped us to understand, and that's, sort of our, what would you say, substitute domestic church. The poor teachers are taking over. My son is right here at Assumption College, learning to be a history teacher, and he's already teaching at Shrewsbury High School. And it's just sad for me to think ahead of the things that are going to fall into his lap as a teacher. He's not a parent. He can't make up for bad parenting. But we have to try to instill these values and understand these topics in our own little family units. Not always easy. So what is some example of how we can be successful? Right here in our state, who's here is a Patriots fan? All right. And I just used this slide when I was teaching in Buffalo last month. They weren't so enamored as you are. And what is it that's helped the Patriots to be so successful? Over the last 15 years, there's been dramatic success there. What is it? Who wants to throw out a name of why the Patriots are so successful? Belichick. Brady. Commitment. I like that. Commitment. Teamwork. Love it. Values.
They've got a well thought out approach and methodology.
Excellent. All right? So they're thinking ahead. They're appreciating certain things. And so here's Tom Brady's answer to why they're so successful. Look who he's hugging. Bob Kraft was said over here. And I want to point out some things about Bob Kraft that has a message for us here today. The Patriots' success rate has been unmatched in the history of the NFL. They have the most wins in any 10-year period. They have the longest winning streak of all time. 14 division titles, 16 conference crowns, and 3 Super Bowls. What is it? Why are they so successful? If you ask Kraft, he says this: you've got to see things that other people don't see. I've heard interviews with him, and it's just fascinating how he appreciates the person and the gifts that they have, and how he can see their commitment, and how he can understand how they're going to work as part of the team and bring that to fruition. If somebody's starting to not be a team player, he says, thank you very much for your service. Here's your satisfactory check, and be on your way. But he sees things that other people don't see. He sees relationships. He sees commitment. He is weary of wayward methodologies. He's honest with his people. They have perseverance. A bump in the road doesn't make them shut down. And they follow the truth about what they believe is allowing us to be successful and thrive in our day and age. And these all foster success or flourishing. So these are the messages that allows this organization to be so successful. So I'm going to, I jumped over slides, sorry, yes. So here's the slide next. I'm going to mention 2 myths, and then we'll get into how we save embryos and how we treat infertility. So 2 myths, and Linda mentioned it to a degree here. There is no proof that contraception avoids unwanted pregnancies in teens. There's no proof. You don't have to take my word for it. I'm going to show you more. The reason that there's no proof is because there is no success in avoiding these pregnancies because of a concept called risk compensation. That means that the teenagers will say, oh, I am protected, and therefore I can do X, Y, and Z behaviors. And they try behavior X, and they find out that they feel healthy and they have not achieved a pregnancy, so they will now try behavior Y, and so on. It goes up the ladder like that, and Planned Parenthood knows this. That's why Planned Parenthood is pushing contraception in teens. And look what it's brought us. I like this slide. Han Solo says to Chewie, "What a wonderful smell you found." And that's the way some of us doctors across the country and across the world are thinking of this contraception epidemic. What a wonderful smell you found. And Linda pointed out all the sexually transmitted diseases, broken relationships, poor understanding of our sexuality, poor understanding of marriage, poor understanding of relationships. What a wonderful smell we have found. Patients and the National Institutes of Health is hoping for something different. One of us NaPro technology doctors has been courted by the NIH to try to bring our research and our experience to the NIH. They understand as we do, that all of these things, as Robert Kraft has said, are very, very important. And they will foster success and flourishing in our schools, in our homes, in our communities. Like Robert Kraft, we know that we need to enhance the romance, not just enhance the genitality or the, as Linda put it, in the frameworks to satisfy certain things with certain adverse, unhealthy behaviors. That we focus on relationships. I heard somebody call out that when we talked about the Patriots. We need to focus on honesty, and we need to focus on a total self-giving. This is what Humane Vitae talks about in the Catholic teachings. A total self-giving, not a total self-taking, which contraception fosters. We need to focus on this commitment and know that that's what breeds a successful state, a successful country, a successful marriage, a successful family. The people who are not committing to each other and dedicated to each other are ending up on welfare and costing the state more money. Those that are committed are bringing about $500,000 for every new person born in this state over that person's lifetime. The state will receive $500,000 over this person's lifetime in state reserves. We need to have perseverance, as Bob Kraft says. So, there is a group out there, and a teaching method, not a teaching methodology, but we're trying to reach out to medical schools and help them to understand these principles. It's all of these things that I've said are proven. There's documentation for it, and this group, FEMC, Fertility Education Medical Consultants, or something like this, FEMC, is trying to bring that into medical schools. Okay, so there's a glimmer of hope and helping the young doctors that are coming up to understand what's truly successful in our country. Myth number 2. IVF is not necessary to solve most infertility situations. It is a very low success process. It is a very high cost process with tremendous losses, both in the health of the woman and in the embryos that are created. And you'll be seeing that in a second. But just to know that there is a much better option, which you'll see in a few minutes. So, as Bill Belichick said, not Bill Belichick, Robert Kraft said, you've got to see things in other people that other people don't see. That's what our message is here. We understand the beauty of that child and the gifts that child has been given by God that are going to come to fruition right from the moment of conception. So what happens in the IVF center when you have all of these embryos? A woman who goes through an IVF process usually has on the order of 6 to 12 embryos created in that one cycle. And she's oftentimes going back for more cycles at a cost of $12,000. Please have it up front before you walk in our doors. So instead, what I have here and what I'm bringing to the insurance companies as we speak is what we might call a value-based approach to infertility. And you and I might think values meaning Christian faith and beauty of an embryo and the potential of that embryo, but rather to the insurance companies it means that I get high value for my premiums that are submitted. Value means the quality divided by the cost. That's value. And it just so happens that we're sitting on a gold mine, us NaPro technology doctors, of tremendous value. And we call it, instead of calling it NaPro technology, which sounds a little bit Christian, we instead call it restorative reproductive medicine, which is really at the heart of what doctors are supposed to do, right? If you go to the emergency room short of breath, you don't expect everybody to receive a prescription for amoxicillin. That's going to miss the people that are there with shortness of breath because they have heart failure. That's going to miss the people that are there because they have the pulmonary embolism. It's going to miss the people with pleural effusion, COPD, on and on. It misses all of those people because you haven't done any diagnostics. Doctor is supposed to figure out why somebody can't achieve a pregnancy and then restore that It's just like restoring eliminating the shortness of breath because you figured out they have heart failure and they really need digoxin, not amoxicillin. So, back to the secrets that we understand, as Robert Kraft would say. Let us make man in our own image. So we have very special dignity, and it carries over into the assisted suicide movement. We have very special dignity, and the way that we're brought into this world is very, very precious. And we need to try to respect that, we need to try to foster that. If it's not working well, we need to try to fix it. So I'm going to try to take you back to have an image of how God created us and how He created new life to be brought into the world. We have many examples in the animal kingdom, how bacteria divide, how viruses replicate, how worms multiply, how zebras reproduce. But for humans, it's much different, and it's very, very special. So we turn to the book of Genesis, and we hear about Adam and Eve. And as you saw, I try to keep a nautical theme here. So it's hard to find a nautical picture of Adam and Eve. But here's my best shot at it. The alligators are not bothering anybody, and Adam is totally committed to Eve, total self-gift, and appreciating Eve, and respecting Eve. And Eve is similarly respecting Adam. That's what it's all about, and the commitment that should be there in that kind of relationship. And then God blesses that with saying, let us use this, us, the Trinity, let us use this to bring a new life into the world. So, normal fertility can be explained this way. This is basically translating donum vitae into mathematics. Eve and Adam and God say yes. So we have the self-giving love of Eve and the self-giving love of Adam and the Creator who is love, and that brings about a new person. Isn't that awesome? What about infertility? Infertility, there is a disorder. It's a very important word, disorder. As St. Thomas would say, a tree is ordered to reach for the sunlight, capture that sunlight, and reach for the nutrients in the earth and bring them to bring about fruit. That is the order. A disorder means it interferes with the process of either conceiving or sustaining the pregnancy. So, back to our mathematical equation, we have mom, dad, and God, but there's a disorder interjected in between. So what should the job of a reproductive endocrinologist be? To remove the disorder, no? Because this beautiful couple is lacking a certain capability, and that leads, instead of to a new person, leads to disappointment. You need to understand, however, that infertility is not the disease, just like that shortness of breath. Shortness of breath is not a disease. Shortness of breath is a symptom. You cannot breathe very well because you have an underlying disorder. Infertility is a symptom of many possible processes. A doctor's job is to figure out which process applies to this couple and fix it. Right now, the leaders in the world that do this are at Creighton University School of Medicine in Omaha, Nebraska. Dr. Thomas Hilger is a good friend of Dr. Rollo and I, is there working his butt off to try to get the research out there that other medical schools and insurance companies will respect. And they have labeled that work NaPro technology, which is short for natural procreative technologies. Technologies. It's not some off the beaten path, herbal supplement kind of thing. It's technology, ultrasound, surgeries, lab work, interventions. But it's trying to foster the natural things that are happening in our body, and it's with respect to the fact that we procreate, not reproduce. Procreation identifies that God has a hand in all of this. So with regards to infertility conceptions, we have successfully removed the disorder. And that allows the mom and dad and God to bring about a new person. Here's an example from my practice. This is TJ. His mother is a Boston College philosophy professor who, as she likes to joke, drove past 4 IVF centers every day to get to my office. Very committed. It was a matter of months that we worked and figured out what was wrong, why she could not achieve a pregnancy, and then fixed it. And then the most important word on that page, in my opinion, is the smallest word on that page. Then mom and dad and God did their work. So let me teach you a tiny bit about our fertility so that you can understand why NaPro technology can be so successful. There's so many things that can interfere with this process of achieving a pregnancy. It just astounds me when you see a picture like from India with this very crowded marketplace. How could all those people be in this world when I know how many things can go wrong with this process? It is so sophisticated. So the process of the sperm even getting to the fallopian tube. Most of us would think, oh, that means blocked tubes. Wrong. Blocked tubes are like 2% of people. And yet that's the whole reason that the IVF centers made their excuse that we need to exist. Oh, there's women with blocked tubes, you know, we have to, that's 2%. But there is blockage to sperm very, very often, and that's at the level of the cervix, at the lowest part of this picture. That cervix is very important for making cervical fluid, as you will see. So the sperm can't even get to the egg. And then the poor ovary has been bombarded oftentimes by birth control pills for many years, and the lining of the uterus might be thin, and the aging of the gametes, and all of these things. One of the key workhorses in the fertility process is the ovary, of course, not just to release the egg, but to generate estrogen and progesterone. And it goes through a cycle. A follicle here on the upper right is called into function by the pituitary gland. The follicle grows, and as it grows, it makes more estrogen until it reaches a mature size about 2 centimeters in diameter, and then it ruptures if all is going well. But there are 6 things that can go wrong in that rupturing process. And then the cells that were making estrogen in the top portion are now making progesterone in the bottom portion. They do that for about 13, 14 days, and if there's no pregnancy, that little corpus luteum will shrivel up. And here's a picture or a diagram of those hormones, how it behaves from one menses on the left to the next menses on the right. The hormone estrogen rises when you have that mature follicle and an ovulation takes place, and then progesterone comes on the scene and becomes the dominant hormone. What are hormones? Hormones are messengers. They're carrying out different functions in the body. The brain has receptors for estrogen and progesterone. The blood vessels do. The clotting factors do. The lining of the uterus does. The cervix does. The pituitary gland does. All have receptors for listening to these things. But the pharmaceutical industry is trying to find substitutes that they can patent for these things. But none of the substitutes talk to the receptors as well as the actual hormones. And these hormones control the glands in the cervix to make a very sophisticated fluid. And most of us are not taught this in medical school. But right there at the bottom, or in the lower third, where it says cervix, that's where pap smear is done. Unbeknownst to most people, that is where a very special fluid is made. And that fluid has very special properties. And those properties change throughout the woman's cycle. As Linda said, there are only about 5 or 6 days in a cycle where someone can get pregnant, and it's got to do with that cervical fluid. Because sperm need that cervical fluid to survive. Sperm without that fluid will die within hours. You don't need condoms, you don't need spermicides. They will die within hours in the vagina because the vagina is very acidic. Sperm, however, with good cervical fluid can live up to 5 days. That extends, and that image of India and these people in a crowded marketplace is that cervical fluid that allowed intercourse on any one of those 5 days to achieve this beautiful pregnancy days later. And just a quick diagram of that cervix. This is an enlargement. The womb is above, the vagina is below, and the cervix is there. And some call it a biological valve. But more than that, the channels that are made in the cervical fluid are specifically the size of a normal head of a sperm. Doctors that do not understand this will harvest the sperm and put an injection, a catheter right through the cervix and dump the sperm in the womb. But you have before you a very precise structure, the cervical fluid, that a woman can detect at the opening of the vagina. She knows when it's there, as long as she's taught very simply how to detect it. And that is a biological filter. So if you have a sperm with a bigger head, has extra chromosomes, it can't get through there. If you have a sperm with multiple tails, it can't get through there. And surprised you may be to find that the sperm production is, if you're lucky, 15% normal. The job of the testicle is crank them out. Millions of them. A normal sperm count is at least 20 million. Most of the time 60 million. Crank them out. I don't have to worry about quality control that God says because I've made an awesome filter. Now you might say, what about a sperm that has a smaller head and a fewer number of chromosomes? That must be able to whip right through there. Wrong again. Because of diffusion properties, the sperm can wiggle and jiggle in any different direction, whereas the sperm with normal heads, it's like a one-way street in New York City. There's no way you're turning around. Quick synopsis of the cervical fluid. Now I have to get into NaPro technology. And the basis of NaPro technology is this thing that we call the fertility care system. It helps a woman to track her cycles, whether she's 13 years old or 50 years old. She can track her cycles, and it brings extremely powerful information to her and her doctor who understands these things. So you have one cycle charted there. The woman is making her observations. She sees her bleeding patterns. Each of these stamps represents one day with a description below. So her first day of her cycle starts with her first day of bleeding, and that was a heavy day. And the next day was heavy and medium, medium, light. And then she sees no bleeding and no mucus. But on the 10th day of her cycle, she starts to see some mucus, and she labels it, easy for us to understand, with a sticker that has a white baby on it, because that baby is able potentially to be achieved at that day, and she knows it. It's not retrospective, it's not the old rhythm method, it's not Catholic roulette, it's prospective. She knows each and every day whether she can become pregnant or not. But more than that, what we're going to turn our attention to, instead of family planning, which this is a very, very good method, better than the birth control pill, instead of focusing on that, we're going to see how it helps doctors like myself and Dr. Rollo to understand what's wrong in the woman's system. This is a very normal chart of a woman who's charting 3 cycles. One patient charting 3 cycles, and you see the day that she labels with a peak day is her day of ovulation, and it varies. On the first cycle it's day 14, the second cycle it's day 9 of her cycle, and the third cycle it's day 20. So it varies normally. And a couple is trying to achieve a pregnancy. You see I, meaning intercourse. They had intercourse the day before and the day after her ovulation. She knew which day she was ovulating, and her period didn't start, and it didn't start, and it didn't start, and she knows that she's pregnant, and she confirms it with a pregnancy test. And when all is working well, this is what we have. My son Andrew meeting his brother Peter for the first time. The teachers are very professionally trained. There are training sites all over our country right now. The premier of those is at the Pope Paul VI Institute in Omaha. Fertility care centers are springing up all across America. And if you want to see a listing of where these teachers are and where these doctors are, you can go to this website, fertilitycare.org. I'll present this again at the end. And here's someone who's breastfeeding, and about in the middle of the chart they start to wean, and then her cycle starts to come back. She can see that cervical fluid happening. That's that fluid that we saw in the cervix that allows the sperm to survive. And then down on the 1, 2, 3, 4th line, she has some very good cervical mucus, and that's actually her ovulation, and 12 days later her period starts for the first time since she's been weaning her baby. So you see, that's just an example of how this works, and we are trying to focus on the couple's relationship at the same time that we're teaching them this very powerful tool. How does that apply to infertility and NaPro technology? Well, unfortunately, 15% of couples in the United States are infertile, and that number is growing. In fact, if you look at people in their 30s, 33% of them, 1/3, 1 out of 3 people has infertility in their 30s. Sperm counts are dropping in the United States. We are the lowest in the world, and the westernized countries are leading the way in low sperm counts. When you have such a common problem, then you're going to have a business that follows it, and I represent it this way. How does Snickers have to do with IVF? IVF, of course, means in vitro fertilization. Otherwise, we could call it artificial reproductive technologies, which means these infertility centers. What does a Snickers bar have to do with that? Hungry? Think Snickers, right? Infertility? Think IVF. This is a picture of ICSI. Inside that very thin glass needle, you can see the sperm. The needle is being stabbed into the egg, and the sperm is being injected. That's called intercytoplasmic sperm infiltration. And they're doing this very commonly. Well, what happens to that poor egg that's been stabbed? There are an increase in birth defects, but people hold out and say, oh, that's fascinating. The media says, that's fascinating. But remember, infertility is not a disease. Infertility is a symptom. They haven't fixed it. They haven't identified what's wrong. NaPro technology seeks out the underlying causes. It repairs them using current medical science, and facilitates conception through the loving and self-giving action of husband and wife. Love it. Every day I go to work, I say, this is cool. I'm so privileged to be in this position. People just, they keep coming and they say, Dr. Carpentier, why didn't I hear about this before? I now have 3 frozen embryos, and now I hear about this. Oftentimes they're hearing about it from the priests. They should be hearing about it from their doctors and their friends. IVF, on the other hand, is different. It has a different approach. It's putting themselves in that beautiful position of mom, dad, and God, right in the midst of that. And it's choosing which sperm, which egg, and it's doing it in vitro, outside of a woman's body, and putting it back in. So it's bypassing something that might be wrong, which they don't have a clue what it might be, but it's bypassing it, putting this beautiful new person into an unhealthy system. And wait till you see their miscarriage rate. But in the meanwhile, it has separated the unitive from the procreative. It treats life as a commodity. Give us the $12,000 and we'll give you 8 embryos. It is not bound by the union of husband and wife. They can choose sperm from an MIT graduate or an NBA player. It is not founded on the acceptance of, it is founded because of the acceptance of abortion. You can't have embryos in a petri dish if you haven't already accepted the idea of abortion. And it's a springboard into cloning and other embryonic research. Instead, NaPro technology seeks out the disease and tries to fix it. So I have some examples for you. We figure out, is it the problem with the lining? Is it a problem with the sperm? Is it a problem with the tubes? Is it a problem with the mucus? And somebody who's charting will give us beautiful information. These are 5 different women in this case. All of them have infertility. And I can look at those charts and tell what is the problem. The middle person, C, probably had HPV, as Linda pointed out to us, a virus that affects the cervix that can lead to cancer, and so she had her cervix frozen. She's no longer able to make cervical fluid, but we can help. And you'll have an example of that in a second. The other problems, in the top case, very limited cervical mucus because her ovary is not working well. I can fix that. Next one down, B, it also has limited mucus. Even though you see 5 days of mucus, it's very poor mucus, and I can help that. That person in B probably has endometriosis, and that needs some surgery to fix it. So here's something that should resonate with the message of Citizens for Life. We can identify people at risk for a miscarriage before they even achieve a pregnancy. I'm going to show you quickly some cases of that. This woman is charting her cycle, and 2 things jump off the page to me, my trained eye. She has poor cervical fluid. In fact, her mucus cycle score, MCS, equals 5.7, should be 9 to 16. She has poor mucus, which reflects poor ovary function, and that's depicted in the bars at the bottom. The black bars represent blood tests that she had that show estrogen, and the red bars to show progesterone. Those numbers of progesterone should be way up here. The red bars should be way up here, and the black bar should be way up here. So just by looking at her chart, I knew she had ovary troubles. And then to top things off, The last 4 days being some spotting there, the red stickers, that's not supposed to be. That only happens in infertility couples. If someone has 3 or more days of spotting before their period starts, they have infertility. That's depicted here. When I show a slide like this, there's only like one point on it. You don't have to stress about it. The point here is that the people that had premenstrual spotting and said yes, they were only in the infertility group. We have lots of data that I could give you data for 2.5 days on all these points that I'm trying to make. This woman, the baby implants after conception out in the fallopian tube. It takes 8 days to implant. So she ovulated here. And 1, 2, 3, 4, 5, 6, she starts her period. Where's that baby? Baby's en route to the uterus, but the lining is already shedding. And we can see that. And it's demonstrated by see the low red bars? She's not making any progesterone to support the lining. We can fix that. It's very simple. $15 prescription for progesterone instead of $12,000 at the IVF center, and we don't freeze any embryos. This one, again, we knew there was a problem because she had very limited mucus. And if you see the second line down, that little black writing says her follicle is not big. It didn't reach 2 centimeters. She has an immature follicle. And if that follicle ruptures, that egg is not mature. It can be fertilized, and that will lead to a miscarriage. She still has her LH surge, that red graph there. So her LH kit, ovulation detection kit, is positive. She says, I'm ovulating. No, you're not. Not healthily. And this depicts that we can tell people at risk for spontaneous abortion because of their mucus cycle scores and many other factors. We can even tell people at risk for ectopic pregnancies. I won't belabor the point. And this is mucus cycle scores in ectopic pregnancies. And finally, people with subtle infections of the endometrium, very high risk for miscarriage. We can see them in their charting as well. Let me give you one example, a very simple success, vitamin B6. I love this picture. This woman is not making any mucus in the top cycle, next one, no mucus. But at the beginning of the 5th cycle, she starts some vitamin B6 because vitamin B6 helps cervical fluid to be produced. And she had 1 day of cervical fluid in this whole year. They could see it because they were taught. They have intercourse that day, and there's the ultrasound picture of her baby. $5 of vitamin B6. Other causes include endometriosis, and a little caution, there's some laparoscopy pictures. That means we're going to be inside mom's belly. She's not pregnant at this time, it's before her pregnancy. And we see a classic example of endometriosis. All of these red dots are not supposed to be there. They're very inflammatory, they cause pain. Not always, but oftentimes cause pain, lots of scarring. But the biggest thing is, I'll show you another picture, the biggest thing is that these red spots will trigger the immune system to attack her ovaries. And her ovary, as you've learned, is very, very special. An ovary under attack doesn't function well, and she's at high risk of infertility and miscarriage. Here's the success rates. If we look at the right-hand graph, the yellow curve is the best, it's called the best in our country, Johns Hopkins University, for treating endometriosis. The blue bar, which is more successful at achieving pregnancy, is the Pope Paul VI Institute in Omaha. They don't get any press. They think, oh, this is just Catholic stuff. We don't need to give them any media attention. But their success rate is much greater. At the bottom is 12 months, 24 months of trying to achieve, and the success rates you see is statistically significantly different. The left-hand bar is similar. That's with polycystic ovarian disease. You can have endometriosis on the ovary, and very carefully that can be resected, and the ovary will function better. Low sperm counts, what about those? Do we have anything we can offer? Absolutely. Here's on the X, the man has his semen analysis, and it's horrible. The estimated effective sperm count is 189,000. Remember, it's supposed to be more than 20 million. So anything less than 20 million, urologists would say, not going to get pregnant. Go to IVF. They'll take a sperm, they'll meet it with the egg, and put the embryo back in the womb. Not so. This couple achieved just by having intercourse around her day of ovulation. So, is this Achievable in Massachusetts? Absolutely. Dr. Mark Rollo and I are seeing patients from all over New England. Mark's in Fitchburg, I'm in Gardner, and our success rate is 64% deliver. Unfortunately, 36% don't achieve a pregnancy, but believe me, they're so appreciative because they know why they couldn't achieve a pregnancy. More than that, these people go on and deliver second, third, and fourth children. Their PMS, meanwhile, is 92% better or resolved, and just a sidelight, postpartum depression is resolved in 98% of people. So now to conclude, I have some pro-life messages and some more stats for you to keep in mind. I'm going to go fast through these two. 96 times more likely to miscarry in an IVF center than in Gardner. And that's based on their own data where they're losing this is a big take-home point, they're losing 6.7 embryos for every one that's born. And that is just counting the embryos that they put in the womb. It is not counting the embryos they leave in the petri dish, donate to science, freeze for later, throw in the trash can. It is not counting those embryos. This is only the ones they transferred, and they're transferring fewer and fewer because they realize the premature birth rate when you put 3 embryos or more in the womb. Whereas our data in Gardner, 0.07 embryos lost for every one that is born. That's pro-life. People do not realize this. I calculated this only weeks ago. I took all the data that I could get from the IVF centers nationally, and I calculated, and I was shocked to see they are losing 99% of the embryos that they create. Meanwhile, they're helping only 1.5% of the infertility couples, actually 0.5% of the infertility couples in our country. And yet they get all this media attention. Some data, 25% are brought to the womb, but miscarry, 74% are left behind and discarded. But with NaPro technology, we prepare for and support each embryo one at a time. Another pro-life message is the average miscarriage rate in our country, just the regular couples trying to achieve a pregnancy, their average miscarriage rate is 16%. In IVF centers, it's 86%. What a wonderful job they're doing. Okay? They're losing 86% of the people that walk in the door. Whereas in NaPro technology, we're unfortunately still miscarrying 7% of the time. But you notice these are high-risk people, infertility, miscarriages that are coming to us, and we are decreasing their chance of miscarriage tremendously. Meanwhile, only one set of twins in now 25 years of doing this in my practice. One set of twins. No triplets, quadruplets, octomoms. Actually, I do have 5 octomoms, but they were one pregnancy at a time. Thank God for that. Rate of twins. This is NaPro Tech studies out of Ireland, Canada, and in my practice, the twin rate is very, very low, but the IVF rate is very high. Now in Massachusetts, 27% twin rate. And in Massachusetts, insurance covers it, so that people are more willing to just put 2 embryos in at a time. Other countries like California, they'll put 8 in, and that's where these stories of octomoms come from. So nationally, the rates are much higher than in Massachusetts. Rates of triplets, 0 for all the NaPro Tech doctors across the world. IVF, 2.5%, and they'll talk about selective reduction going in and killing one of those. I have to wrap up just to show you that the health of the baby is very poor. Twice as likely to have prematurity, low birth weight, end up in the neonatal intensive care unit, very high cost. And that's why insurance companies really are excited about what NaPro technology is doing. The birth defect rate is double, the chance of the baby dying is double. But NaPro technology, despite high-risk patients, is at the norm. And I will leave it at that, and I will open it up to some questions.
Just one question.
One question.
Sorry.
Or comment.
I wanted to know, does contraception contribute to infertility over the long run? I mean, extensive.
Does contraception contribute to infertility? Tremendously. Tremendously. The leading cause of sexually transmitted diseases is contraception. People are saying, I'm safe, I'll go out and I'll have sex with a variety of people. The more people you have sex with, the more sexually transmitted diseases, harm your tubes. You need to have HPV treatment of the cervix, which we saw decreases that. So that's an indirect effect of the contraception. There is also a very, even more powerful direct effect on the woman's body, which is to these beautiful receptors that are listening for estrogen in the cervix to make that mucus. They are bombarded by the very loud messages of the birth control pill. These artificial hormones are so potent that the receptors in the cervix diminish. Imagine being like in a rock concert, and this is a big speaker. And you're standing, wow, wow, and you come home and your mom's talking. You say, I see your lips moving, Mom, but I don't know what you're saying. That's the cervix after the birth control pill. Dr. Odeblad in Sweden showed that the mucus production is horrendous, even 18 months after stopping the birth control pill. The sperm can't get to where they need to go. And when the young woman is given the birth control pill, the doctor ain't talking about that. And he's going to get sued if she gets pregnant, not if she has infertility later. So thank you very much for your attention.